And I'll click record as well. Oh, and actually somebody's saying that they can't see me. Paula, you might have to log back out again because I do have the video showing and I can actually see myself now. Maybe if I resume my screen share, can you see me now? Because it looks like other people can see me, and I did make sure to click record. So if for some reason you can't see me, if you guys could log out and then maybe log back in again, it just might be a little bit of a technical issue. Okay, perfect. So it looks like that worked. And I wanted to mention too, can everybody find the chat box that's to either the right-hand side of your screen or the left? Because once we go through the mock exam questions, I like you to be able to answer them for me, just so I can see how everybody's answering, and that if people are having more troubles with a certain question, then that means that I can explain it a little bit more. But if everybody gets a question right, then I can move on to the next one. Because I do have a lot of questions. I have a feeling like we won't be able to go through all of them because we only have a half an hour today. But I do have a lot of questions here. So I'll try to get through as many as I can. Now, they're all in multiple choice format because the board exam is multiple choice. And this is for dental hygiene and dental assisting students, okay? So it's for everybody. And some people are just trickling in right now. Now, I want to check Facebook quickly. We have about 3 minutes just to see if anybody was having any technical issues. Now, those of you who are here now, did you have any issues logging in or clicking the link? Did you have to download anything in particular? Just let me know because I'm curious. Because this is a new webinar hosting software for me. I haven't been using it for that long. And I have it on my computer. So when I download it, it just sort of comes up on automatically. But I wasn't sure how it would be for all of you guys. Let's see. Okay, perfect. So it looks like people are doing well so far, and we will get started in about 2 more minutes because we do have a lot to cover. But I hope everybody's excited because for those of you who are taking the board exam in September, it is coming up quickly. Now, I know being excited is not the right word for it, but think about it this way. Soon you won't have to study so much, right? Even when I took the board exam a while ago, I was so happy to be done. I didn't know if I had passed or not at that point, but I was just so happy to be done because it meant that I didn't have to study anymore and that I could have a life once again. So I know it seems like a lot of studying right now, but just remember that soon enough you won't have to study anymore. I know it seems like you don't have a life, especially for the long weekend, since you're all here now at 9 o'clock on a Saturday. So thank you. But you know what? I did have some extra time, so I just thought it can't hurt to go over some questions with you. For those of you who are part of the Board Exam Prep Academy, you may have seen some of these questions before, but some of them are new. But even if you've seen the questions before, that's okay, because then that means you should have them perfectly right at this point. And if you still get the question wrong, and you might be thinking, oh, I know I've seen this before, but I got the question wrong again, then that means that you need to do some additional studying on that topic. So, okay, guys, it's 8:59, 1 more minute. Let me check my email quickly, just to make sure that nobody had any issues. Because I have a feeling like some people are going to sign up but then not look at the digital file, and then they won't know to go to the Facebook group to get the link. So because I didn't want to put the link on for everybody because I can only accept a certain number of people in this webinar chat. So I only wanted it for people who would actually show up, right? So, okay, so I got no emails. One more check on Facebook, it's 9 o'clock, and then we can get started. Now, I'm curious though, for those of you who are here now, is everybody taking the board exam in a couple weeks, or are you guys taking the board exam in a couple months? If you don't mind just letting me know in the chat box, that would be awesome. Because I think most of you are probably taking it in a couple weeks, yes. So I'm sure you're excited to get some extra studying in. Okay, and even if it's a couple months, that is okay because it doesn't hurt ever to go through extra mock exam questions. Okay, so it looks like we have some people taking it in a couple weeks, some people a couple months. Somebody still has another 7 months, but that's awesome because the sooner you start, it is so much easier for you, trust me. Like if you study a little bit every day, it's a lot easier than having to study everything in such a short amount of time, but it is possible though, you guys. So even if you are starting to study, let's say now, it is possible, trust me. It just means you have to study a little bit more and a little bit harder. So, okay, neat. So it looks like most of you are able to use the chat box, so that's wonderful. And let me see, can everybody see my screen okay? There's no issues with that because on my screen here, I'll be going over the mock exam questions. So I'll kind of show you guys what this is all about. So for those of you who are part of the Board Exam Prep Academy, you kind of know how this works. And for those of you who are not, that is okay because I will explain everything. So it's pretty simple. So I will show you what it looks like. I will have a question up on the screen here with A, B, C, or D. Read through it, and then if you could please let me know your answer in the chat box, either to the left or to your right. It depends on the computer system or the Mac that you're using so that I can see your answer. And then when I see that most of you have answered, then I will go through the actual answer and I will talk about it. Now, some of these questions are easy. Some of them are a little bit tricky and some of them are pretty hard. And I do that so that I can see sort of who's answering the easier questions, who's answering the hard questions, things like that. And it's supposed to make you think. So even if you're looking at a question and you're thinking, oh, wow, this is really easy, it might not be because you have to make sure to read the question perfectly. So I'll stop talking and I will let you all think because we do only have a half an hour. So can everybody see the first question here? So what does it mean when a drug causes malformations in a fetus? A, B, C, or D? And I'll try not to talk too much because I know that some of you probably have to think. But please answer for me so that I can see, okay? And I do consider this, by the way, a very easy question. So if this is hard for you, you need to study your special needs conditions once again, because this is a very easy question. And I should mention too, if you guys don't mind sending me your answers privately so that other people can't see, because I don't want people to look at the other answers from you all and then maybe pick another answer themselves. Or if it's possible, don't look at other people's answers and just sort of answer what you think first. But it looks like everybody did get this one. Not everybody has shown up yet, so I do hope that everybody can log in. But again, I started with a very easy question, and it looks like everybody got this right, which is perfect. So yes, this is the best answer. They like to ask this on the board exam. So it doesn't matter if you're a dental assisting student. It doesn't matter if you're a dental hygiene student. They will ask this on the board exam. And typically they like to ask you guys the different categories. So does everybody know the different categories to tell if a drug is okay for the fetus, if it's, I guess, safe, I should say, for the fetus? Is it not safe? Is it kind of, well, it could be safe, it could not be safe, they're not sure? Does everybody remember the categories? I'm just curious. If somebody could answer for me, that would be awesome, but I will talk about it. And while you're answering, I'm going to put that down. Remember the categories of drugs that are safe and unsafe for the fetus. Okay, good, perfect, excellent. Very, very smart here. So A, B, C, D, and X. So did everybody hear me there? A, B, C, D, and X. Notice how I did not say E. That's not a category. They will try to trick you on the board exam. So if I'm confusing anybody, let me know now. So the categories A, B, C, D, and X, there's no E in there, with, yes, A being the safest, X being not safe. So category X. So think about that. So, yes, thank you. I will write that on the slide. You are right. A, B, C, D, and X. So these are the categories here. And if you need some additional help with this, please let me know. And once again, this is all inside the Board Exam Prep Academy. So for those of you who are members, I do apologize if this is sounding familiar to you, but that is actually a good thing because it means you are paying attention, right? So A being the safest and X being unsafe. So when we're thinking about drugs that are the safest, think you're like Advil, Tylenol, ibuprofen, things like that, okay? So those are considered safe. But having that said though, ibuprofen is not in category A, it's in category B, and that's where a lot of students mix that up. I'm not saying that they always have it on the board exam because they do not, but it's good to know though too for the real world also. So if you have a pregnant patient who comes to you and says, you know what, I'm in my 3rd trimester, I get migraines often. Is it safe for me to take ibuprofen? I mean, you're not a medical doctor, so I would always start off by saying, well, you should speak to your doctor, but ibuprofen is actually a category B type, so it's considered safe, but is it a category A, the safest? No, Tylenol is actually safer. So I would almost say, but A, Tylenol is safer than ibuprofen, so I would even be more inclined to try that first. You know, does that make sense? If somebody comes to you and is in their 1st, 2nd, or 3rd trimester, and they're asking you for morphine, which they wouldn't, hopefully, but so that's kind of a bad example. But morphine obviously isn't safe, and it probably will cause issues. Alcohol isn't safe, and it will cause issues. So it's good to know the different categories. And if you're not sure how to break them down, you will find it in any pharmacology textbook. The Darby and Walsh, I don't know if it's that specific in your pharmacology unit, but you will find it in your pharmacology textbook. Okay, guys, so we'll move on here. But if there's any questions, please just stop me at any time. Elena, what section is it in the Board Exam Prep Academy? You know what, I'm sorry, I'm not sure because I did update it recently, but it would be in your special needs section, and the slide, or I should say the PowerPoint, would be labeled pregnancy and special needs. It could be labeled just pregnancy, but something like that. So you will find it in the Board Exam Prep Academy. If you can't find it though, just let me know, because I know there's modules 1 through 8, and I'm sorry, I can't think of which module it's in now, but if you can't find it, just let me know. Okay, so let's go through the next one. So again, we're talking about pharmacology here. So when talking about drug action, what is the efficacy? A, B, C, or D? And again, I'll stop talking to let you all think, but please answer for me. That would be excellent. And while you guys are answering, I'm going to check Facebook again, just to make sure that everybody's able to log in who wants to. But it's also Saturday night on a long weekend, so I'm thinking some people thought they may be able to attend, and then they're thinking, no, never mind, which I can understand. And this is a trickier one, by the way, so don't be concerned if you're thinking, oh my God, I have no idea what this is. This is a trickier one, but you have to know it. So if this is hard for you, please go through your pharmacology unit. And the good news is for the Board Exam Prep Academy members, you have all of this, you guys. But if you're not, look in your pharmacology textbook. It's so important because they love to ask pharmacology on the board exam, unfortunately, because it's hard. So I'm getting a few different answers here, so let me talk about it. Okay, Sorry guys, just trying to fix my slide here. So, okay, so when talking about drug action, what is efficacy? So it is the last one. So the maximum response to a drug regardless of the dose. So does everybody understand what that means? So that means, let me think of a pretty common example. So let's say somebody has a migraine, and they think, well, if I take 5 Advils, that will work a lot quicker than if I take 1. Well, that's not true, okay? So efficacy means that a drug will work a certain way no matter how much you take. But then you have another issue, because if somebody's taking 5 Advils, that's not the proper dose, and they are going to become sick. For some people, taking 5 Advils could become very, very sick. For a child, they could even die. It could be poisonous. So does everybody understand that this is just talking about, it doesn't matter how much of something you take, the maximum response to a drug regardless of the dose. So the maximum response means how the drug is going to act, and the dose is talking about how much of that you are taking. Let me think of another example for you guys. I'm sorry, that's, I think, kind of the best example that I can come up with that makes the most sense. But does everybody understand that, or is that confusing? Now, this is in your pharmacology book, so if you're not sure, please have a look. So again, pharmacology is not easy. This one I consider an easy question. So what could cause a local effect or irritation? So you have to know what local means, you have to know what local effect means, and then you have to know what irritation means, which may sound simple, but simple questions can become very hard very quickly, especially if students are studying too much. They have so much in their head that even a simple questions like, oh, I wasn't expecting this, I don't know the answer, right? So it's so important to read the questions and read the answers too, slowly. But this one's kind of a simple one, and I think everybody's doing pretty good with this. So let me move on here. So yes, topical anesthetic. And again, this is pretty simple, but I have had students have this wrong in the past. So that's why I wanted to talk about it. So the other answers are simply just not the right answers because they make no sense. A is more of a systemic reaction. Topical anesthetic is as local as possible because, as you all know, topical anesthetic is used for that tooth or teeth. So a specific area. You wouldn't put topical anesthetic all over the mouth. It would be localized to those certain areas. C is not the right answer because I've never known anybody who has a local effect or an irritation to x-rays. I've just never heard of it. And checkup x-rays would kind of mean the same thing as C, so that's not the right answer. But I'll move on because that was a pretty simple one. So, okay, this one's a thinker again. So what is the method of action of bronchodilators? So you need to know what that is, and then you need to understand, pick apart the answers and really understand. Now, this is a tricky one, but I feel like I kind of gave you the answer in the answers here, because if you know anything about bronchodilators, this is kind of a, easy one. So if you get this wrong, then you really need to study pharmacology, okay? You'll need to study special needs, you will need to study asthma and the effects that bronchodilators have. But it looks like everybody is getting this right so far. So you know what? I think I'm making these questions too easy. I made the mistake last time of making the questions too hard for people. These I think are too easy. So I think next time I'm going to mix it up a little bit. So, okay, so the answer is B. I believe that everybody had that right. Is anybody not sure about this one? But I think everybody had this right anyway, so you should be fine. But stop me if you have any questions. Okay, awesome. So let's talk about a case study here. So let me make the font a little bit bigger for you. Okay, so Joan always comes in for her cleanings every 3 months. She is always asking questions and wants to do her best. She smokes 1 pack a day, but she feels if she quits, she will gain weight. She feels her oral health is good enough now to start whitening, and she insists she will continue coming every 3 months. Joan has seizures, but she's responding very well to her medications. She hasn't had a seizure in over a year. Upon examination, you notice evidence of mouth breathing. So I'll give you guys a second to read that again on your own, and then I will go through the questions here. So I'll give you guys about a minute, maybe a little bit less than a minute. But I'll stop talking so you guys can read that. Okay, so pick apart the main things in there, okay? And then after I give you guys the next question, I will go back to the case study. So, okay, question. How do you know the client is a mouth breather? Here are the answers here. So I don't need to go back to the case study for this one because it's just simply asking, well, how do you know that the client is a mouth breather? So what do you guys think? Okay, so far so good. You guys are doing very, very well. And yep, Elena, you are right, because I know that you were not sure, but yep, you are right. Okay, so let me talk about it. So yes, so A is the best answer. Now, some of you did pick B, and some of you guys picked C. So the thing about this case study, so let's talk about it again. So notice the key words here. So for those of you, because a lot of you did pick B, so a lot of you picked the answer is that the client told you. But I'll tell you why that's not correct, because you notice in the last sentence, it says upon examination, you notice evidence of mouth breathing. So that's why B is not the right answer, because she didn't actually tell you this. You had seen it in her mouth, okay? So that's why. But a lot of you did pick that. So that is why I felt that I did have to explain it. But you know what? And that's okay, because this isn't, you know, you taking the exam now. This is you practicing. This is good practice, because for those of you who picked B, you're probably kicking yourselves saying, oh, I knew that. But you have to read the questions slowly, right? So yeah, so the answer is A, because anytime you see a patient, if there's a lot of bleeding in the upper and interiors only, that usually means they are a mouth breather. Like I see patients all the time with light plaque, light calculus, but then I clean their upper anteriors. There's hardly any plaque there, but the gums are just going crazy. So typically they are a mouth breather. For those people who have chronic allergies and their noses are stuffed up or something, they breathe through their mouth. So typically their gingiva isn't being, what am I trying to say? Like it's not healing overnight if it's constantly exposed to the elements. So that's why if somebody is breathing through their mouth, their gingiva isn't getting a chance to sort of calm down. So the gums aren't healthy and they bleed upon cleaning. They may bleed upon flossing, upon brushing, pretty much anything. Yes, and somebody is saying with smokers, their gums are vasoconstricted though. And yep, you are absolutely right. And then she's asking, so they don't show signs of inflammation. See, and that's a tricky thing, because I know a lot of smokers that bleed a lot. I know a lot of smokers that should bleed a lot because they have a lot of plaque and a lot of calculus, but they don't. So it's always a a tricky thing, because I know in your textbook it does say that if you have especially a heavy smoker, their gums, and I'll put that down here actually, the gums would be vasoconstricted. That is what the textbook says. But you know what? That's not always the case. So that's another reason why C is not the right answer. She smokes a pack a day, so I consider that a heavy smoker. The textbook may not consider that a heavy smoker, but you know, it's just, that's not the best answer, if that makes sense. So in this case, when the question was, how do you know the client is a mouth breather? Think simple. How do you know? What did the case study tell you? Upon examination. So that is why. Does that make sense though to everybody, why that is the case? And yes, exactly. And somebody also said, and I will write that down, the mouth would be very dry if breathing through their mouth, which can lead to bleeding. So yes, absolutely. Like I know I get my allergies a lot and I can't breathe through my nose because it's all stuffed up. But I don't notice any extra bleeding when I'm flossing, but I also floss every single day and I have light plaque and light tartar. So that could, you know, be helping it. And I'm sorry, I just wanted to correct my spelling mistakes here. So does that make sense though as to why this is the right answer? I think it does. I think everybody's okay with that. I think for the next one, you guys, if you guys want to join me tomorrow, I'll come up with some more trickier case studies. Okay, so I will do that. Okay, so let's do the next question here. What is her chief complaint? And I'll let you guys read through these, and then I'll go back to the question. What do you guys think? And I'll go back to the question. So what is her chief complaint? So here's the case study. And read through it if you like. So what is her chief complaint? And does everybody understand what a chief complaint is? It means, what is her main concern? So she may not have said, my main concern is, or I want this now. But you have to look and see what's the most important to her, because sometimes patients aren't that obvious. Like, I'm more concerned with this, or the main thing that I want is this. So as a dental hygienist and a dental assistant, you have to listen to them. So what is the chief complaint here? And we only have like 6 minutes left. Time goes by really fast when it's only a half an hour. What do you guys think? And this is actually a tricky one. And Elena, I wish I could make it longer, but I am actually tutoring at 9:45, so I can't. Things are pretty busy come now. So this was kind of the only time I did have. Okay, so let's go back to the answers. Let's see, where is that? Whoops, I just gave you guys the answer, but that's okay. So, so what is her chief complaint? And this is a tricky one because 2 of them are correct. And I think I had given you guys the answer anyway, so I will talk about it now. Okay, so what is her chief complaint? And there's a few answers here. 2 of them are correct, but 1 being the most correct, and I'll tell you why. So B is the most correct. So she wants to whiten. So that is her chief complaint. Now A would be correct too, because she did mention that. So let me show you guys here. So I'll read it quickly. So she wants to come in for her cleanings every 3 months. She is always asking questions and she wants to do her best. She smokes a pack a day, but she feels if she quits, she will gain weight. So that is why that answer is not the most correct because it's not her chief complaint. She's just simply saying that she smokes a pack a day, but she doesn't want to stop because of she feels she will gain weight. But that has no, it doesn't have everything to do with the oral hygiene. But then as soon as she says she feels her oral hygiene is good enough to now start whitening. So that has to do with her oral hygiene. Does that make sense? Those two answers are so correct, but one of them is the most correct, and that's the one about the whitening. So did everybody see that? And Elena, good question. So Elena's asking, do chief complaints have to do with hygiene? Not all the time, but in this case, you had to pick one, and that's why the most correct was the one after that she talked about the oral health. So does that make sense? So the chief complaint doesn't have to be about hygiene or her oral health. Like if she had said to you, you know, I'm mainly concerned with if I stop smoking, I'm going to gain weight. If that's what she said to you, then that is her chief complaint. But let's say she had two chief complaints. So let's say if she said to you, you know, I don't like the color of my teeth, and my main concern is that if I stop smoking, I'll gain weight. But I know if I stop smoking, my teeth will be a lot lighter. So do you see how two of those things kind of, they relate to each other, the whitening and the smoking? And she knows that if she stops smoking, her teeth will be whiter, but she doesn't want to stop smoking because then she feels that she will gain some weight. So does that make sense here? But that is why B is the best answer. Okay, oh my God, it's 9:27. See, I talk way too much, you guys. I'm sorry. This is a tricky, no, it may not be a tricky one. It's hard to say. Okay, so I'll go over two more questions. So what could be a seizure medication? So in this case, you guys have to know your medications, I'm telling you. And again, you do have the medications in the Board Exam Prep Academy. Memorize them, I'm telling you. And we do actually have a pharmacology session coming up. We have a session on Wednesday about oral pathology where we also talk about medications. So please make sure, ladies, to come to that session if you're a member of the Board Exam Prep Academy. It's going to be very important. It will probably be closer to 2 hours, so please come. And pharmacology, same thing. But our pharmacology is in a couple weeks, I think. Or no, sorry, I think it's next Sunday. I'll have to double check, I'm sorry. But even for pharmacology and oral pathology, for the members who are new in the Board Exam Prep Academy, make sure to click on the button that says previous recordings, I think it said. It could say past session recordings. Click on that because you have everything right there also. You will have all of the pharmacology sessions that we have had. So click there too so you can sort of practice as much as possible. Okay, sorry, so let's move on. See, you guys, this is a tricky one because a lot of you are getting this wrong actually. So let me talk about it. So it's actually all of the above. Now this one is the most common one. So that's why a lot of you said this. But if you look in your textbook, it's all of them. The board exam will try to trick you because we all know the more common medications at this point, but there's still other ones. And you guys have to know, I'd say the 3 or 4 most common meds for everything. I know it's not fun, but it's true. So this is kind of a memorizing type of question. If you weren't sure, please look in your pharmacology textbook. I know it's 9:30, but let's go through one more here. So this is more along the lines of community. So what is a low but also constant level of occurrence of a disease in a population? What do you guys think? Community is not easy. We do have a session coming in a couple weeks where I'm going to go through all of the different indices, and everything, okay? It's not a fun topic. Students usually do not like me because it's boring, but you guys have to know it. So don't worry, we will be going through that if you are a member in a couple weeks. And if you wanted to catch up with community, I do have a previous session as well. So please make sure to look at that. And I think I even have one on YouTube that you don't have to pay for. So have a look because there's lots of videos. Okay, so this is a hard one, so let's talk about it. So actually, it is the last one, okay? So this is the best answer, endemic. So let's read the question again. So what is a low but constant level of occurrence of a disease in a population? So it couldn't be A, because this, how do I explain this? Well, I'll explain why this one is the most correct. So a perfect example is the common cold. This happens, right? Everybody or a lot of people get a cold in the wintertime. So it is constant. So this always happens, but it's low in the sense that it doesn't mean that everybody will have it. If you take care of yourself, if you wash your hands, eat properly, you get enough sleep, the occurrence is actually low, but it's constant. So every winter you will hear about why it's so important to get the flu shot, to take care of yourself, to stay home if you're sick, things like that. So this is a perfect example of a low but constant level. So does that make sense? But let's say a lot of people had it. So let's say you live in London, Ontario, and everybody in London, Ontario had it. Some people in Toronto have it, some people in Woodstock have it, but everybody in London has it. That's different. That would be an epidemic. Okay, so, and this is in your community notes. If you have the Mosby's, it's excellent for community, but it's a very boring textbook. It's a very hard textbook, but community you do have to know. I do have some mock exam packages only on community. If you're interested, let me know, where I go through what you need to know for the board exam, and that's it. Nothing more, nothing less. So it's up to you, but that might help you so you don't have to read the whole textbook, right? Over and over and over again, because it's no fun. Yes, Elena, I completely agree. Like, even when I was a student, it would have been nice to have teachers sort of explain things in a certain way so that, you know, you don't feel like you have to read the whole textbook over and over and over again, because unfortunately that's not helping you. It's not helping you because the textbook is not easy. It is hard, and you read through it in school. So you have seen everything before. So even if you restudy it, it's just not as helpful to you than if you look at something else. You know, look at questions, look at mock exam questions, videos, notes, sort of different things, because that will help you a lot more than if you're only reading the textbook. Because trust me, if you're only reading the textbook, you will fall asleep quite fast, especially the Mosby's, because it's a very not fun textbook to read. So, okay, let's go through one more and then we're all set, because we talk, I think I might have answered this for you guys anyway. But anyways, what is an epidemic? And then I do have to go because I don't want to be late for my other students. But what do you guys think though? What is an epidemic? So I did talk about it. So let's see who was listening. Let's see who was listening. And would you guys be interested in going through some case studies tomorrow night? Because I know it's a Sunday of the long weekend, so it's just, I don't want to be the only person here, right? So, because I have other things to do too, but if you're all interested, then I'd be more than happy to. Okay, good. Then how about we have another session tomorrow night and at 9, and I'll put on a lot of case studies. Perfect. Okay, but I think everybody got A right, so that's excellent. So yeah, so we're talking about an epidemic. And remember, a low but constant level is an endemic. There is a difference. Please study community, okay, you guys? It's so important. They ask about it on the board exam, and that's the one topic where like 90% of students don't do well in at all. But that could mean the difference between a pass and a fail, right? We don't want that. We want you all to pass. So, okay, so that's it for now. We will go through some more case studies tomorrow night at 9. But since I'm here, does anybody have any questions? Any questions about anything? Because I have about 5 more minutes. Oh, yes, anytime, you guys. I will upload this actually now. I will upload it on YouTube. So as soon as it's done processing, I hope I clicked record. Did I? Yes, I did. Okay, good. So I will upload this now and I'll post it in the Facebook group. It probably will take about 20 minutes. So it might take about 20 minutes. So sorry about that, but then I will post it right away. Any other questions at all? I do hope that this helped. Like, were the questions too easy, too hard? I'm thinking they were too easy, right? Because I'll make some harder ones up tomorrow and case studies so that way I can see who's, thinking, because the case studies are hard, because even if you know the answers, as soon as you see it in a case study, you're kind of thinking, oh, I thought I knew the answer, but I didn't. So I'll make it in a case study for sure. And Shannon's wondering, oh, how to sign up for the Board Exam Prep Academy. Actually, you can't sign up anytime. Let's see if I remember the link here. Let me put the link down for you guys in case you want to. I believe it's welcome.html. So yes, you can sign up anytime, but let me tell you guys, there's a lot of information in there, okay? So if you're more interested in just reading the textbook, then do that instead, because in the Board Exam Prep Academy, at this stage in the game, you cannot do both because there's a lot in there. I prefer you look at the notes because they're a lot easier to understand. And in the notes, there's everything there. So if you study hard, 6 hours every day from the notes in the Board Exam Prep Academy, you will be fine. In fact, the members in the Board Exam Prep Academy do have a 22-day study plan that I show you exactly what to study. So it's less than 22 days now, but that's okay because I show you guys exactly what to study because it's from modules 1 to 8. So there's a lot there, but you will pass. It's all right there. So I believe I have the link here. If you need anything else, though, just let me know. If you have questions, just let me know. And Miriam is asking, how high of a percentage will, are you asking how high in a percentage will there be new questions on the board exams? Because usually for the board exam, there's 3 or 4 different tests. And speaking to students in the past who have taken, let's say, the board exam in May and then unfortunately were not successful and took the board exam in September, some of the questions are the same. Not a lot of them. I don't know the percentage because I'm not actually there taking the exam, but I have heard that some of them are the same. But you have to remember there's 3 or 4 different tests. So even if the person beside you or near you has a test, you will probably have a test that's completely different. So I don't know the percentages, sorry, but I'm sure they do have some of the same questions. Any other questions, anybody? Because I do have to leave, sorry, in about a minute. But yeah, and I'll leave you guys my email too. I thought I had it. Oh, I do have it at the end of the slides here. So if you guys need to email me, please email me anytime. I apologize in advance if I don't answer you right away, but since the board exam is coming up soon, I'm tutoring a lot. It may be the long weekend, but I am literally tutoring from 7:30 in the morning till about 10:30 at night, but that's okay. I love it. But if I don't email you back right away, that is why. So I apologize. But hopefully I can see you guys all tomorrow at 9. The link may be new, so I will post that in the Facebook group also at probably 8:30. So I'll come up with some harder case study type of questions. Okay, awesome. Well, thank you all for coming on because I know it's late. I know it's a Saturday, but thank you. I do hope this helped. Thank you so much, Miriam. You are awesome, and you must be exhausted, so please have a good sleep, okay? And yeah, so I'll see you guys all tomorrow at 9, and I do hope this helped. Let me stop the recording now. So it is